My name is Alex Donnelly. I'm a nurse practitioner here at Healthcare Express in Longview. And today we're going to be talking about some very common women's health problems like STDs, STIs, and something even more common, bacterial vaginosis. Some of the more common ones we see at Healthcare Express would be chlamydia, gonorrhea, and one that we'll talk about here shortly, which is not really a sexually transmitted infection, but bacterial vaginosis. Now, the difference between STDs and STIs, some would say that an STD is sexually transmitted disease, one that you may not be able to get rid of, versus an STI being something that is treatable. We call that the sexually transmitted infection. Chlamydia and gonorrhea do have some similar characteristics. A lot of the times there's pain when you urinate, and you can also have a vaginal discharge too. And other things like trichomonas can also carry a discharge, and that would be more of a green to yellowish discharge. And there are no at-home treatments for these infections. And so that is why testing and treatment are important. When you come into the clinic, we can run a number of swabs and even blood work for STD testing that can help us give you the treatment that you need. So if you find that you have been exposed to a particular sexually transmitted infection, we are also able to treat your partner as well. And it is always recommended to let them know so that they can get help too. Bacterial vaginosis is not necessarily sexually transmitted, but it can be associated with sex. Signs of bacterial vaginosis would be things like pelvic pain or irritation, sometimes a discomfort in the vagina. A lot of times people say that it can cause them to have pain with sex, but so can some of the other STDs. More commonly with bacterial vaginosis, the discharge will be a thin to gray, foul odor discharge. Be our first clue to distinguish between if this is bacterial vaginosis versus one of those other pesky STDs. Bacterial vaginosis, there is no over-the-counter treatments for this. A lot of people end up getting bacterial vaginosis though because they do try to at-home treat with things like vaginal pH washes, which are not recommended, as well as douching. One other thing about bacterial vaginosis that is important to know and understand is that this does not mean that you are dirty or unclean. It can happen to anybody, and really all bacterial vaginosis is that the good bacteria in the vagina are outnumbered by the bad bacteria. If you're ever unsure, just come see us. There's no judgment and there will be no lectures, we promise. But we do care, and we want to get you the treatment that you need for the symptoms you're experiencing.
That was perfect.
Literally perfect.
Literally perfect. You did so good.